recorded. So I'm just going to press record now, and you should get a button pop up on your screen asking whether you're happy for this to be recorded. You won't be in the recording at all because this is a webinar, so it'll just be myself and Tamara who'll be delivering the talk that will be captured. But obviously, if you're not happy with that, unfortunately, we will have to ask you to leave the webinar. And then with the recordings, we put them onto a monthly lecture series playlist where we've got all of the previous talks that we've had on there, so you can access the talk again afterwards. And we'll also send you around the recording as well, alongside kind of a list of resources that you might find useful if you're interested in applying to medicine in the future. This evening, we're going to be using Menti, which is kind of an interactive feedback website. So it's very straightforward to use, and we'll give you the code. You need a different code for it. We'll give you the code as we get started with the lecture. But like I said, it's very straightforward, and it just allows the talk to be that little bit more interactive. If you've got any questions tonight, there is a Q&A function on the bottom of your Zoom window. If you could put any questions you have in there rather than in the chat, because they're that little bit easier to find. And you also should have the option to upvote with questions. So if you want, if there's a particular question that many people have found interesting, it will get bumped to the top. So it just lets us know what you'd like us to respond to. And we should have a good chunk of time at the end for questions to be answered as well. Also, if you've got any questions about terminology as we go through, so if there's anything that you're a bit confused about, if you could pop that in the chat, that would be great, because then we can stop tomorrow and we can get a bit of an explanation about that. So please, if you're confused by anything, do let us know. We can get clarification for you. Lastly, in the email that you got to the talk, you should have noted that this talk is going to deal with death and suffering. There were some resources sent out for you if you do need any support, but please do refer to those if you're affected by anything in tonight's talk. So I think that is everything with regards to housekeeping. I'll now introduce our speaker for the evening. So Tamara Malenga is a Foundation Year 2 doctor based in Oxfordshire. She is a BSMS alumni, which is where she gained both her undergraduate degree in medicine and her master's in global health. She has been involved in global health and health equity endeavours for 9 years. This has included roles within the Brighton Lasaka Health Link, Students for Global Health, International Federation of Medical Schools Association, Cathod, and MedAct. She is a Global Health Corps Fellowship alumnus and completed her fellowship working at the Centre for Infectious Diseases Research in Zambia. She is a published scientific author and most recently a community educator focused on COVID-19 vaccines. So welcome, Dr. Malenga. Thank you so much for giving up your time this evening, and I will now hand over to you.
Thank you very much, Alice, for that wonderful introduction. And thank you, everyone, for tuning in, for giving up your evenings to hear all about this. So I'm just going to start sharing my screen with you all so we can get into the presentation. Okay. Now, I know that for many people, when you get into a talk and webinars, they tend to be quite long and there are a lot of points, and sometimes you get to the end and you think, what were the actual takeaways from this whole presentation? So I decided to put those first. So then that way, even if you get to the end and you're not sure what we should have covered, you would have written this down. And so the main focus of this talk is going to be about global health and about collaboration, really the importance of collaboration in us being able to achieve the goals that we have for societies and for the world at large. And so one of the first takeaways that I hope you get by the end of this talk is that different perspectives are always better than one. And now in my journey through global health, some of the people that I look up to have always said, there's a danger of a single story, a danger of always focusing on one perspective, regardless of whether you have good intentions behind it, that we should always take into account the different experiences of people in order for us to come together and come up with the best solution. The other takeaway is that inequity and poor health in one region affects all regions. And I think this is something that has really been highlighted by COVID-19 and all the variants that we've heard coming up in the news. See, when you focus on just improving the health of the people that you consider to be similar to you, either whether it's your community or whether it's people within your own country, because we interact with each other so much these days, and because we travel around the world, poor health in another region can very easily and very quickly affect people that are close to us. And so it's important that when we move forward with improving healthcare, we take into account our neighbors and those in the wider global community. And the last takeaway that I have is that the future is more connections and not less. And I think as we get through the talk, it'll become a bit more apparent as to why I've added this in here, because I know that we have had negative stories in the media focused on pitting countries or pitting communities against each other. But as we've seen with the rapid development of the COVID-19 vaccines, which were only made possible by different scientists and different communities and governments working together, we've seen that when we bring all our minds and all our resources together, we're more likely to achieve more rather than less. And I, at the moment, cannot see any of you, and it's a bit strange giving a talk to people not knowing what type of people you're speaking to. So we're just going to go to Menti for our first question, where you guys can tell me where you're tuning in from. So we're just going to pause that and then share the screen for us to see where everyone's tuning in from. Okay, so I can see London, I can see Bracknell, I can see Eastbourne, Northern Ireland, I can see Leeds, I can see someone said home, but we don't really know where home is. Cardiff, Rugby, so we have a really good range. Haywards Heath, Hong Kong, someone tuning in from the other side of the world, very exciting. And yeah, keep those coming in, guys. So we have a really wide range of locations that people are tuning in from. And just give us a couple of seconds to settle. Someone from Jersey, so someone from the islands. And I think that's most of our responses coming in. Lancing, Portsmouth, Bath, Ireland, Leicester, Coventry, and I think I saw Seattle somewhere. So I can see that there's a whole range of places that we're tuning in from. And I think it's really fascinating that we've all had this similar idea to tap into this particular webinar. And I hope that moving forward, we'll see that when we have people all around the world who have shared interests, that we can really come together, form those connections, and come up with even more wonderful ideas that can help progress the world moving forward. And we're just going to move on to our next Menti question, which is what age range we have. And this is just so it can help me figure out, what message will really resonate a bit more with you guys to see where you are in life. And I can see that, okay, the bulk of people are in the 16 to 18 group. So people who are doing the A-levels or doing the International Baccalaureate. They have a couple of people who are 19 to 25, a few over 25s, and a few people who are even younger as well. A couple of people who are 11 to 15. So we've got a good range of ages. And I think I was demonstrating this presentation that really the potential for impact and for collaboration spans all the ages, and you don't have to know a lot, and you don't have to have a specific amount of resources or a certain amount of energy for you to really have an impact. And so we're just going to switch back to the presentation, but thank you guys for interacting. Okay, so Alice mentioned to you guys a little bit about my backstory and about my background, but I want to take you guys a bit further back with me, all the way back to when I was born, for you guys to understand the journey that I've been on, things that have influenced my perspective and my approach to global health and healthcare delivery in general. And so I was born
Sorry, everyone. I think it's frozen. Bear with us. We will worry tomorrow. I think we lost you just as you were starting to talk about growing up and your background.
Okay, sorry about that, guys. Technical issues, but I'll just get everything restarted. I'm just going to go back to sharing my screen. Okay, so I mentioned that I grew up in Zambia in Southern Africa. And at the time that I was born in 1993, that's when the HIV/AIDS pandemic was really taking hold of most of the world, and more specifically in Southern and Eastern Africa, where many people were becoming infected, and sadly, many people were also dying. And at that time, it was very similar to what we had going on last year with COVID-19, where you have this new disease and people don't know exactly how to treat it, people don't know exactly how people are acquiring it. And so there was a lot of suffering and a lot of sadness. And for those who don't know, HIV is a virus that affects the body's immune system and causes a lot of other, what we call in medicine, opportunistic infections. So, infections that someone who's got a strong, healthy immune system wouldn't otherwise get. People who have very untreated HIV, which then can go on to develop into AIDS, can then take hold of their body, and they have a lot of infections and illnesses that sadly killed many people, and it killed a lot of people in the prime of their life. And so you can see where the X is, which is when I was born. The blue line on the graph really depicts the number of people or percentage of people who were becoming infected with HIV. And then the red line is the number of new people. So the blue line is the number of people, old people and new people who are becoming infected. And the red line is the number of new people who are becoming infected. And the green line was the number of people who were dying after becoming infected. And while you can see from the graph that a lot more people became infected than died, a lot of people ended up with other conditions that made it difficult for them to carry on with life. And these were people who were in the prime of their lives, mainly between the ages of 15 and 40 years old. So as you can imagine, whole countries were really devastated. And during that time, medication to treat HIV and AIDS had just been developed and had just been made available in Europe and North America. But this was a very expensive medication. At the time when it first came out, it cost $10,000 per person per year for them to be treated. And if I tell you that in Zambia, where I was from, approximately 14% of the entire population were infected, that would have meant a lot of money that the government had to pay out. But this sort of injustice, the fact that people who were poorer were just left to die and had no other options in life, really stirred up a lot of frustration and a lot of anger in the hearts of the average person, both in Southern Africa as well as in North America as well, because before HIV and AIDS treatment became available, they also experienced dying without having any access to treatment and knew what that suffering felt like. And so this period within the history of medicine resulted in a lot of unlikely collaborations between groups that hadn't previously interacted with each other. And so you had the Treatment Action Group in South Africa, which is a group of citizens who campaigned for their government to really push hard for them to have access to medication. And they collaborated with church groups and gay rights groups and other civil rights groups in the United States, who at the same time also held protests, petitions, did fundraising for people within Southern Africa and Eastern Africa and Africa as a whole to be able to have access to HIV and AIDS medication. And this extended to other countries that were really struggling with the rate of infection, as well as not being able to afford the medications. And this was a very early example of how successful collaboration can really be when people bring their ideas and their resources together in order to achieve a common good for society. And after years of protests and petitioning of governments and pharmaceutical companies, in 2003, we then had the creation of PEPFAR, which is the President's Emergency Fund for HIV and AIDS Research and Treatment. And this was created in order to provide relief for many countries who were suffering. And at the time, it was set to about 18 countries, but this then extended to many countries around the world. So this happened in 2003, and it happened, a date that really has stuck in my mind because it happened at a time when I was in primary school and I had attended my first funeral. So somebody in my primary school had passed away as a result of HIV and AIDS, and really brought home the impact that not having access to medications can really have on someone's life, even if they have enough resources to go to school and to get meals. If they can't access the basic healthcare within their own countries, it really does leave them with very few options in life. And this was a hugely successful endeavor. And from the time that it started in 2003 to date, it has saved approximately 17 million lives. And so the PEPFAR scheme has saved the equivalent of the number of people who live in Scotland, Wales, and Northern Ireland put together, with a few extras added on top. So that's really, really phenomenal. And that's something that many people at the time did not think would be possible. And I went on, carried on, and got to sort of GCSE age, the age that some of you are at, thinking about what I wanted to do with my life. And in 2010, just before I applied for sixth form, the Haiti earthquake really stunned the world. So this was one of the most catastrophic earthquakes at the time, mainly because of the level of destruction that it left behind in Haiti. Now, Haiti is a country in the Caribbean, and Haiti is a country that's had a history that has been filled with both triumph as well as a lot of sadness. And at the time, Haiti was already struggling with a very weak public health system that was in the process of being built up, and people were in the process of trying to build themselves up as well and improve their livelihoods when this struck and really decimated the whole country, including one of their main treatment hospitals. And this was something that really stuck in my mind and resonated with me as a young person, because in the midst of all this destruction and all this sadness, I then came across these groups that were covered on the news, such as Médecins Sans Frontières, and you can see their logo on the t-shirts of the people in the picture, and other groups such as the Red Cross, who came from all around the world. So at that time, people pulled all their resources from the United States, where musicians held concerts to raise money to buy food, water, funds, and whatever was needed. And you had all these volunteer groups from around the world that came to help build Haiti back up and help to provide the necessary services that people needed. And it really highlighted to me how when you bring together the resources that you have, when you bring together the minds, the power, and the ideas of different people, that you can really help a situation, help a country or society move forward. And that's one of the reasons why I'm very passionate about collaboration and encouraging people to work together. So I was quite lucky in that I got into BSMS. I got into Brighton and Sussex Medical School fresh out of sixth form, having done the International Baccalaureate. And at BSMS, I was very privileged to find many groups that were working on collaborative projects, one of which was the Brighton-Lusaka Health Link, which was started by Professor Melanie Newport. And it's a very unique and very successful partnership between the Royal Sussex County Hospital and the University Teaching Hospital in Zambia. So this was started on both ends by staff members who saw a need, mainly within Zambia, for training or within specific health regions, within specific health departments. And they partnered together to figure out a framework of how they could help transfer knowledge between the two hospitals. And so the Brighton Lusaka Health Link is one that has done many successful projects in helping to train nurses and helping to provide the pharmacists in Zambia with the resources in order to create new policies and make things better for the people using the services. And at the time, I had just been introduced to this world of collaboration. I was 18, fresh out of sixth form, didn't really think I had much to contribute. But within this organization, I still managed to find a place for myself in which I could contribute something useful and spend a lot of time raising money for the charity, but also got the opportunity to meet with Zambian medical students who then came over for medical electives, which is where you get experience in a different hospital from where you've trained. And we also shared ideas on how they do things and how we do things. And it really highlighted to me how important and how beneficial it can be for both parties when you engage in these sort of projects where you learn from people who are in different environments to yourself. And the journey that I've had through medical school has really been like a roller coaster with different highs and different turns that really were all sort of highlighted and quoted by the different collaborative moments I'd had. And so halfway through my medical school journey, I was then able to embark on a master's in global health, which is also offered by Brighton and Sussex Medical School. And this gave me further opportunities to collaborate, this time with people outside of medicine. So I had a housemate who was doing a master's in law, but was also passionate about health and health improvement. And she directed me towards my next big milestone, which was the Global Health Corps Fellowship. So this is a fellowship that was open to anyone between the ages of 21 and 30, and all you needed was a degree of any kind and a passion for global health and social justice. And I then embarked on this journey with my global health family, who you can see in many of the pictures. And we did many projects where we helped to highlight the work, the very important work that community health workers had been doing, but as well as us learning from each other and learning from our different experiences, because we came from Zambia, the United States, and had different upbringings and different exposures, and we're really able to share that and bring the best of what we knew and what we'd experienced in order to improve things at the organizations that we worked for. And since qualifying as a doctor and in the midst of a pandemic, I've still found opportunities to collaborate and to work with other people, especially around vaccine campaigns and doing educational sessions via Zoom, where the general public get a chance to ask their questions about the COVID-19 vaccine, particularly if they're hesitant. And this has really been a very worthwhile experience, especially using technology and showing how when you connect with people, it can really make a difference to the health choices that they make, as well as the decisions that they make. And this was a really exciting and eye-opening experience for me, because many people I've worked with have been from a media background or from a background of just community organization, but we've all used our skills together. And some of you might be wondering why I've chosen to focus on this as the topic for my webinar. And I focused on this because I was reflecting and thinking that before COVID-19, and even in the midst of COVID-19, a lot of countries had been focused on a rhetoric of looking after their own and not focusing on the needs of those who they saw as different from them, or those that they saw as outside of their bubble of responsibility. And this has been occurring in Europe, where we saw highlights about different countries within Europe who chose not to allow any refugees to come into their countries because they thought it wasn't their responsibility to look after them, as well as with the stories from the previous United States government that really pitted the US against China, which really did hurt the average person within China and the United States who has a business, who has a farm, and was not able to sell as usual and to make ends meet for their families. And lastly, more recently within South Africa, a lot of xenophobia and corruption has really threatened the success of the vaccine distribution, because even though people are all facing the same threat of COVID-19, some people feel that if you're not if you don't share the same passport as me, don't share the same language as me, then you shouldn't be entitled to this particular treatment that my government is providing. But we both know that COVID-19 does not discriminate based on nationality. It does not recognize borders. And so really, we have to focus on ensuring that we are all covered and that we are all looked after, because the health of our neighbors is going to affect us. And I think when you look back in history as well, we have many lessons that we can take from. For example, the creation of the United Nations, which came after World War II to ensure that countries never again find themselves in a situation where they destroy each other because of particular issues. And while the United Nations and the WHO have their criticisms and have made mistakes in the past, I think we can't deny that they've been a great force for good in uniting countries and helping us to move forward together and setting standards for good living in the world. And the WHO, which I'm a bit more interested in because of my health background, has also been a huge force for good in encouraging countries to share knowledge, to share information, and to share resources during the time when SARS first came through, which was one of the very early serious flu-type pandemics within recent history. The WHO coordinated the sharing of data from Southeast Asia, where they'd been able to isolate what type of virus was causing this food in order to develop the vaccines that the rest of the world could use. And more recently, if it were not for the WHO, I think many countries may not have had that incentive to share information about new variants of the COVID-19 virus, and also to contribute towards a scheme that's called COVAX, which is where countries that are more well-to-do, that have a bit more money, and that may have bought more vaccines that they need, then put them into a pool that will then help to be shared among low and middle income countries that may not have the resources or enough resources to buy enough vaccine to cover their populations. And I think these are good examples that show that in the past, working together has been beneficial. And so moving forward, working together is also the way that we should continue. And we're going to go back to Menti and see whether you guys have heard of any other collaborations, any that you want to share that you think have been beneficial for society at large. And I'm just going to switch screens. Okay, let's see if this is going to work. Can we see? Are we able to put our answers through?
Hi, Tamara. It's just saying that the quiz isn't open, so you might need to just reopen the quiz for us.
Okay.
Oh, that seems to be...
Oh, I can see icons, but I can't see any words. I can see different avatars, and I can see I think there's been 105, 112.
Start the, if you can start it. There, we should be able to see the question now.
Okay, let's wait and see if we get any responses. I don't know. Claire and Alice, can you see the question?
We can see the question. I think there's a timer at the bottom, so maybe when that runs out, the responses will come through, possibly.
Okay, yeah. Yes. So we've got, oops, I don't know why. Yeah, there we go. Ignore that, your answers are not wrong. So I can see WHO, mentioned UNICEF, really good. Red Cross, very good. EU, Gavi, NHS, NATO, really good answers, guys. And can we go further down? Can't seem to be able to scroll down to the rest of them, but I can see that we've had a lot of really good responses from you guys. And yeah, those are all really good, and those working together for the vaccine, that's correct. And I'm just going to go back to my main screen. Okay, and so we went through really good examples, and some of you might be wondering, how exactly does collaboration help to improve things? Why does it work, and how does it make things better if people from different parts of the world or people with different mindsets come together? And I'm going to use a couple of case examples to sort of illustrate this point. And the first example that I have is that of Rwanda. So some of you may or may not have heard of Rwanda. So this is a country in East Africa. And during the time when I was growing up, Rwanda was well known, but for the wrong reasons, unfortunately. Because in 1994, Rwanda suffered the worst genocide in recent history. Approximately 1 million people were killed and displaced from their homes, and it was at the time the worst level of violence and civil unrest that the world had seen. And this left Rwanda really devastated. So we've got this graph here, which on the y-axis we have ages, and on the x-axis we have years. And I know the numbers are a bit small, but if you follow the blue line, you can see as it got close to 1994, the life expectancy in Rwanda dipped down to only 26 years. And as some of you may have calculated when I told you what year I was born in, that means people like me who are 27 would have either been dead or on our way out, which is mind-blowing when you think about it, that the country had such a low life expectancy because so many of the infrastructure, health services, and all the things that we have put in place at the moment in order for us to live healthy lives were non-existent. At the time, about 75% of children were not fully vaccinated, and over 75% of women became infected with deadly diseases during the time of their pregnancy. So it was a really, really horrible time in Rwanda. But Rwanda, as I'm sure you guys can see from the graph, really turned things around for themselves. And this was in part due to the collaborative approach the country took to building itself back up together. And this especially took place in the Ministry of Health, where they chose to partner not only with other ministries like focusing on partnering with transport ministries and finance ministries. They also partnered with outside organizations to see how could they create a better and more sustainable system in order to improve life for their country. And there was an article in The Guardian a couple of years ago that really highlighted how Rwanda has been a miracle story within the world of development and health, because they are one of the only countries that has managed to more than double their life expectancy in only 20 years. So the life expectancy in Rwanda went from only 26 years to 69 years, which is getting closer to the global average, which is approximately 69 to 70 years old. And one of the ways that they did it was partnering with internal but also external organizations, one of which was Partners in Health. And this is a non-governmental NGO, which means it's an organization, kind of like a charity, that is focused on health and not focused on making any profits. And they partnered with the Rwandan government and Rwandan people to see what they needed and make sure that they were able to make this come true. And so with their partnership, they were able to triple the cancer care that was provided. And at the time, many other countries surrounding Rwanda do not have or have barely any form of cancer care that is available. They were able to increase access to mental health, again, at a time when it was not fully recognized, even in high-income countries in Europe. And the other thing that they were able to do was decrease maternal mortality, which is the number of pregnant women or women who have given birth within a 6-week period, and reduce the number of them who were dying as a result of pregnancy and childbirth related complications, which again exceeded almost everyone's expectations for the country, because after the genocide, many had written it off and it had become one of the poorest, if not the poorest country in the world. And this is a really fabulous example of how partnership and collaboration, working with people from the ground up, can really help to improve things and turn things around. The other example that I have is one that is a bit more local. So I talked about the Brighton Lusaka Health Link when I referenced my journey through medical school. And I'm going to speak about two particular programs that the Brighton Lusaka Health Link has been involved in. One was one of their earliest endeavors, which was pediatric nurse training within Zambia. And in the two photos, you have one with our Zambian colleagues who are standing by a bus stop in Sussex after they'd come for a visit in which they were observing and seeing what bits they could learn and take away when building up the course in Zambia. And the other, we have some nursing colleagues from the Royal Sussex County Hospital, who then went to meet Zambian colleagues to help plan out, to have meetings with those in positions of power to explain how it would be beneficial for the country and for the hospital to be able to have this course established. And between 2014, when they started this, to 2018, when they last collected some data, they had trained 184 pediatric specialist nurses. And this was really important because many people, if they're not in health, do not realize that when you train as a nurse and as a doctor, it's really important to have specific training on how to look after children, because in illness, children are almost like a different species. Things are very different with their bodies compared to adults. And so many children were having signs missed or having cases that could have been resolved that were not resolved as a result of the nurses not feeling confident in their skills to recognize these things. And this has been really great because those 184 nurses would then go on to train other colleagues around them when they move, if they move to a different hospital, and really share that knowledge and have it spread like a domino effect. And the other more recent project that they have embarked on is a pharmacy project. And I particularly wanted to highlight this one because it shows that you do not have to be a doctor or a clinician in order for you to make long-lasting, effective changes in the healthcare provision of a particular area. So the pharmacists, again, at the Royal Sussex County Hospital, partnered with their colleagues at the University Teaching Hospital in Zambia to come up with a number of different mini projects and initiatives, which have really been very helpful during the COVID-19 pandemic. I've listed a few of those here, one of which was a hand drop production facility. Again, very handy for the country to be able to produce their own high quality hand drop that is WHO approved. They had infection prevention and control champions. So these are people who specifically go around the hospital and ensure that people are washing their hands, ensuring that we're adhering to making sure that everything is clean and sterile to reduce the chances of people getting infections whilst they're in hospital. And they've embarked on many, many very useful things. And again, it showed the power of collaboration because it started with just the pediatric project, but they've extended this to many other projects which are listed on their website. And I would really encourage you guys to visit the Brighton Lusaka Health Link website and possibly see how you could get involved if you live locally. And another international example that I wanted to highlight is one that might be of interest to some of you guys, because the D Prize is a fund that has been created in order to help people who have an idea about a development project that will improve the livelihoods of people anywhere in the world that are in need of it. And so the D Project really encourages people to work to come together and produce these ideas and come up with something that they have proof will work to improve the livelihoods of people. And I've put an example of some of the projects, and it does not have to be health related. And one of the things that I love about the D Prize is that you do not need to have a specific qualification in order for you to apply. You do not need to come from a specific country, and you do not need to fall within a specific age range in order for you to qualify. As long as your idea is something that you can prove will work and will improve the lives of people, reduce the level of poverty in a particular area, then you're very welcome. And this is something that many of my fellow alumni from the Global Health Corps Fellowship have embarked on and have been able to extend their service to providing an extra project. And some of you might be thinking, okay, we've talked about the why, we've talked about the how it works, but what can we do now and what can we do moving forward? And one thing I want to really highlight is that you should think big. When PEPFAR, which I talked about earlier, was constructed at the time, nobody thought it would be possible, but they said to themselves, let's throw out the status quo and the plans that are officially in place, and let's think of something that will impact the largest amount of people, but also be able to be something that's sustainable and long lasting. And I mentioned Partners in Health when I was talking about Rwanda, and I want to highlight the three of them in this picture, which is Dr. Jim Kim, Ophelia Dahl, and Dr. Paul Farmer. So in this picture, all three of them were younger than I am now. Ophelia was only 18 and a half years old at the time when she met Paul, and later on, a couple of years later, met Dr. Jim Kim, when they came up with the idea for improving healthcare by partnering with communities. And they were young, had no money, had no influential connections at the time to people with power or money who could make big decisions, but all they had was this idea and a commitment to wanting to make things better. And they're all roughly in their 50s now, but they've been able to grow Partners in Health to a very successful, very impactful endeavor that is in many countries, not just in poorer countries, but also in the United States, where they help people around the Boston area and other areas who do not have access to adequate levels of healthcare. And I would really encourage all of you, if you've got access to Netflix, to look up the documentary which is about them and their journey and about Partners in Health, which is called Bending the Arc. And it's one that I sometimes turn to when I'm looking for inspiration to carry on with some of the work that I'm doing, where it just shows their journey and how, as long as you're committed and you have a vision and you partner with the right people as you go along, that you can really achieve the impossible. Because some of the things you might have in mind might be things that don't exist now. And for them, it was something that didn't exist at their time, but now Partners in Health is up there as one of the model ways of doing development and non-governmental work. So I've mentioned a couple of organizations, and you guys can either list these now or refer back to them later when you're looking at the slides. So these are just some organizations that I've mentioned that might be of interest to those of you who maybe want to pursue medicine, or those of you who are already in healthcare or have an interest just in development. And they might give you some ideas of things that you could do or things that you could plan to do in the future in order to progress any aspirations for collaboration that you might have. And with that, I am going to end by saying thank you for tuning in, and thank you for staying this long on to the webinar. And if you want to connect with me after this webinar, you can connect with me on my Instagram, where I do a lot more public health messaging. And so if anyone's interested in seeing that, or if anyone wants to work with me on anything, you can contact me via LinkedIn. I am on Twitter, but I don't really use Twitter that much, so you're more likely to catch me on Instagram, but I do check my messages, so I will see you if you connect with me there. And you can also connect with me on LinkedIn if you want to connect with me professionally. And so with that, I will move on to the questions to see if you guys have any specific questions for me or any questions about admission that the rest of the team can answer. And I'm going to stop sharing my screen.
Lovely. Thank you so much, Tamara. That was really interesting and really